10 Deadly Cancer Signs You Must Never Ignore. Detecting cancer in its early stages can be a game changer. Many of the signs are subtle, easily overlooked, or written off as something minor. However, recognizing these early warning signals can significantly improve your chances of survival. Early detection often leads to more effective treatments, lower healthcare costs, and an overall better quality of life. Your body speaks to you. If something feels off, don't dismiss it. While not all symptoms are linked to cancer, it's crucial to get them checked by a doctor. In this video, we'll explore 10 alarming signs that could point to cancer, and why acting quickly could make all the difference. Let's begin. Disclaimer: this video is for educational purposes only. Always consult with your healthcare provider about any medical concerns. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Persistent pain. Pain is a natural response to injury or strain, but when it persists without an obvious cause, it could be a sign of something more serious. While occasional aches and discomforts are common due to daily activities, chronic or unexplained pain should never be overlooked. Certain types of persistent pain may indicate underlying health conditions, including cancer. For example, bone pain that doesn't fade could be a symptom of bone cancer, while continuous pelvic discomfort may suggest ovarian cancer. Severe headaches that gradually worsen might signal a brain tumor, and unrelenting back pain could point to spinal issues or even pancreatic cancer. These conditions often remain undetected until the pain becomes unbearable, which is why early attention is crucial. Ignoring ongoing pain and relying on over-the-counter medications for relief can be risky. If your pain persists despite rest, lifestyle changes, or standard pain management, it's essential to seek medical evaluation. A healthcare professional can help determine the cause and ensure early diagnosis and treatment if necessary. Your body communicates through pain, and persistent discomfort is its way of signaling that something may be wrong. Don't wait. Listen to your body and take action before a minor issue turns into a serious health threat. 2. Unexplained fatigue. Feeling tired at the end of a long day is natural, but when exhaustion lingers despite proper rest, it could signal a deeper issue. Occasional tiredness is expected, but persistent, overwhelming fatigue, especially when it interferes with daily life, should not be ignored. Cancer-related fatigue is different from regular tiredness. Unlike fatigue caused by stress or lack of sleep, it doesn't improve with rest and can be debilitating. This type of exhaustion may stem from cancer cells draining the body's energy or from anemia, a condition commonly linked to cancers like leukemia, colon cancer, or lymphoma. Anemia occurs when the body lacks healthy red blood cells, leading to weakness, dizziness, and shortness of breath. If you wake up feeling drained despite a full night's sleep or struggle to complete routine tasks that once felt effortless, take notice. Persistent fatigue, especially when accompanied by other symptoms like unintended weight loss, pale skin, or difficulty concentrating, warrants medical attention. Your body may be signaling an underlying issue, and early detection is crucial. Don't dismiss extreme, unexplained fatigue. It's always worth discussing with a doctor. 3. Changes in skin appearance. Your skin can reveal vital clues about your overall health, and sudden or unusual changes may indicate serious conditions, including cancer. One of the most concerning signs is the development of new moles or noticeable alterations in existing ones. Melanoma, the deadliest form of skin cancer, often manifests as an irregularly shaped mole with multiple colors and uneven borders. If a mole begins to grow rapidly, changes in color, becomes asymmetrical, or starts itching and bleeding, it's essential to seek medical attention promptly. Early detection significantly increases the chances of successful treatment. Beyond moles, other persistent skin changes can also be warning signs of internal illnesses. Sores that refuse to heal, rough or scaly patches, or areas of darkened skin might indicate underlying cancers or other serious conditions. 4. Persistent cough or hoarseness. A persistent cough that lingers for more than a few weeks should never be ignored. While coughs are often caused by temporary infections like colds or bronchitis, a chronic cough that refuses to go away may signal a more serious underlying condition, including lung cancer. If your cough is dry, persistent, or accompanied by chest pain, shortness of breath, or unexplained weight loss, it is crucial to seek medical advice. Similarly, hoarseness or changes in your voice that last longer than 2 weeks may indicate issues with the throat or larynx. While hoarseness can be due to overuse, allergies, or acid reflux, Persistent voice changes could be a symptom of laryngeal or throat cancer, especially in individuals who smoke or drink heavily. If you notice prolonged vocal strain, difficulty speaking, or a raspy voice, do not dismiss these symptoms. Early detection is key. Coughing up blood, even in small amounts, is a serious warning sign that should never be ignored. Whether it's bright red or rust-colored, this symptom may point to lung cancer, tuberculosis, or other severe conditions. If your cough persists despite treatment, worsens over time, or is accompanied by other concerning symptoms, consult a doctor immediately. 5. Unusual bleeding. Unexplained bleeding is a critical warning sign that should never be ignored, as it may indicate serious underlying health issues, including cancer. Blood in the stool, for example, can be an early symptom of colon or rectal cancer, particularly if it appears dark or tarry. Similarly, coughing up blood, even in small amounts, could be a sign of lung cancer and requires immediate medical attention. Unusual vaginal bleeding outside of your regular menstrual cycle is another concerning symptom. It may be linked to cervical, uterine, or ovarian cancer, especially if the bleeding is persistent or occurs after menopause. In men and women alike, blood in the urine might point to bladder or kidney cancer, especially if there is no known injury or infection. Even seemingly minor symptoms like frequent nosebleeds or bleeding gums can be cause for concern. While these issues can sometimes be linked to less serious conditions like dry air or gum disease, persistent or excessive bleeding might indicate blood disorders or leukemia. 6. Unexplained weight loss. Losing weight intentionally through diet and exercise is a positive achievement, but when pounds start dropping without any effort, it can be a cause for concern. Unintentional weight loss, especially if you have lost 10% or more of your body weight within 6 months, should not be ignored. This kind of sudden, unexplained weight reduction may be an early warning sign of an underlying health issue, including cancer. Certain cancers, like pancreatic, gastrointestinal, and lung, can speed up metabolism and disrupt nutrient absorption, leading to muscle and fat loss. Appetite loss, nausea, or trouble swallowing can worsen weight loss. Though other conditions may also cause this, unexplained weight loss should always be checked by a healthcare provider, as early diagnosis can greatly improve outcomes. 7. Changes in bowel or bladder habits. Alterations in your bowel or bladder habits can serve as early warning signs of serious health issues, including colon, prostate, or bladder cancer. If you notice persistent changes in your bowel movements, such as chronic constipation, diarrhea, or unusually narrow stools, it could point to underlying problems such as colon cancer. These changes are often subtle at first, but when they persist or are accompanied by other symptoms like blood in the stool or unexplained weight loss, they should not be ignored. It's important to seek medical advice to rule out serious conditions. Similarly, urinary changes such as difficulty urinating, frequent urination, or the presence of blood in the urine may signal problems with the prostate or bladder. While many people dismiss these symptoms as part of aging or stress, they can often indicate cancer, and delaying a visit to a healthcare professional can reduce the chances of successful treatment. Early detection greatly improves outcomes, especially for cancers like colorectal, prostate, and bladder. Staying proactive about your health can make all the difference. 8. Difficulty swallowing. Difficulty swallowing, or dysphagia, is a concerning symptom that should never be ignored. While occasional throat discomfort may occur for minor issues like a sore throat or indigestion, ongoing or worsening difficulty swallowing can signal a more serious underlying condition. This symptom could point to disorders affecting the esophagus, throat, or stomach, including potentially life-threatening diseases like esophageal, throat, or stomach cancer. In the early stages, you may find it increasingly difficult to swallow solid foods, which may eventually progress to liquids. This can occur alongside other troubling symptoms such as unintentional weight loss, persistent heartburn, or indigestion that doesn't resolve with typical treatments. If swallowing becomes painful, or if you notice food getting stuck in your throat or chest, it is essential to seek medical attention promptly. Esophageal cancer, in particular, can cause significant swallowing difficulties as the tumor grows and narrows the passage for food. 9. Swollen lymph nodes or lumps. Swollen lymph nodes or lumps are a common health concern, and while they are often associated with infections, they can sometimes be a signal of something more serious. Lymph nodes are small, bean-shaped structures that play a vital role in the immune system by filtering harmful substances and helping the body fight infections. Typically, when an infection occurs, the lymph nodes can become enlarged as they work to fight off the pathogens. However, Lymph nodes that remain swollen without an obvious infection can be a cause for concern. Painless lumps in the neck, armpits, groin, or jaw may signal serious conditions like lymphoma or leukemia. Lumps in the breast, thyroid, or testicles also need prompt attention, as cancerous growths usually grow over time instead of going away. 10. Persistent night sweats or fever. Frequent night sweats or persistent fevers, particularly when accompanied by unexplained weight loss, fatigue, or other unusual symptoms, can be early indicators of serious health issues, including certain types of cancer. One of the most concerning possibilities in such cases is lymphoma, a type of cancer that affects the lymphatic system. Lymphoma can cause night sweats as the body responds to abnormal cells, and the sweating can be severe enough to wake you from sleep, leaving you drenched in perspiration. In addition to lymphoma, other cancers like leukemia or liver cancer may also present with persistent fever or night sweats. These fevers often occur without an obvious infection, as some cancers release substances into the bloodstream that interfere with the body's temperature regulation, causing unexplained fever-like symptoms. While these symptoms can also be linked to non-cancerous conditions, their persistence warrants a thorough medical evaluation. Please share this video with friends and family. The information it contains could literally save someone's life. Thank you for watching. I'm committed to providing evidence-based health information that helps you make informed decisions about your well-being. Stay vigilant, stay informed, and stay healthy. Until next time, take care of yourself and those you love.